Okay, good afternoon everyone. In yesterday's lecture, we have started with the new topic, that is serotonin, and we have covered some initial points or generic points about the serotonin topic. That is the synthesis, its metabolism, its release, and then the serotonin receptor, how the termination of the action of serotonin takes place. Also, we have seen about the serotonergic receptors, the agonists which are acting on it, then antagonists which are acting on it, then primary signaling mechanism we have seen. Also, we have seen the location of all of these receptors and the major function of it when the serotonin binds to these particular receptors. This all we have seen. Also, we have seen the significance of the serotonin, what significant actions serotonin produces, that all we have seen, and then we have stopped. So further parts we are going to study in today's lecture, and most probably we will be covering about each and every drug which act as an antagonist onto the receptors of the serotonin that we are going to cover today. Okay, so this is the content. So we have covered this first point, the second point, third point, then this one, this one. Okay, so today we are going to see about the actions of serotonin in physiological system, and next is the drugs which affect the 5-HT receptors. Okay, so let me get to the slide. Okay, so the actions of the 5-HT, they are numerous and they are complex, and there is considerable species variation. Okay, so the reason to this why they are numerous and they are complex, it is because of number of receptors which are there in the serotonin receptor family. It is one of the largest receptor family, neurotransmitter receptor family. Okay, and this complexity, it reflects the profusion of the 5-HT receptor subtypes. So it is not that they are present in very fewer locations. Instead, these particular 5-HT receptor, they are present in very wide variety of tissues and organs, and that's why the actions which are produced by this serotonin, they are quite complex to even understand, even comprehend. Okay, so the main sites of action are as follows. That is, the first one is the gastrointestinal tract, then second one is the smooth muscle, third one is the blood vessels, fourth one platelets, fifth one nerve endings, and lastly the central nervous system. Okay, so first we are going to study the effects on the gastrointestinal tract. So most 5-HT receptor subtypes, they are present in the gut, with the exception of those of the 5-HT5, 5-HT6 family. Okay, so only about 10% of the 5-HT in the intestine, it is located in neurons, where it acts as neurotransmitter. We have already studied that the gastrointestinal tract has its own nervous system, which we call it as ENS, and this ENS is responsible for the regulation of gastrointestinal tract motility. Okay, so the 5-HT is one of the component of it, and there it acts as neurotransmitter, and the remainder of it, that is the like 90% of the 5-HT, it is located in the enterochromaffin cells. So enterochromaffin cell, they act as a reservoir, or they act as a storage site for the 5-HT. So it also acts as sensors to transduce information about state of the gut. Okay, and they release the 5-HT into the lamina propria. If you remember the layers of the gastrointestinal tract, you may find this lamina propria as the layer which is just below the mucosa. Okay, so there why we want this 5-HT in the lamina propria is that what these enterochromaffin cells do. These enterochromaffin cells, they act as a monitor, they act as a supervisor. And what they supervise? They supervise the state of the gut. State of the gut means what is there in that particular gastrointestinal tract. Okay, so if there is any inflammation causing agent, if it is there, then that particular agent is causing inflammation or injury to the gastrointestinal tract mucosa. So do we want that inflammatory agent to cause the damage? No. In that case, this particular enterochromaffin cells, they will start releasing the 5-HT, and when they start releasing the 5-HT, it will modulate the peristaltic activity of the gastrointestinal tract. So gastrointestinal tract, the motility will increase. Okay, and as motility increases, it may lead to the vomiting reflex. Okay, so sometimes when we eat something that is not good for our gastrointestinal tract, we vomit it out. So vomiting reflex is a natural process, or it is a type of defense mechanism. It doesn't let that inflammatory or infectious agent to remain present in contact with the GI mucosa. And this is made possible with the help of the enterochromaffin cells. Okay, so the main function of them is to regulate the peristalsis, intestinal motility, then various types of secretions, and the visceral sensitivity. The responses observed, they are quite complex to understand. Okay, the importance of 5-HT in the gut is underlined by the widespread distribution in the enteric nervous system and the intestinal mucosa of the serotonin uptake transporter, that is SERT, which rapidly and efficiently removes extracellular 5-HT, and thus it limits its action. So inhibitors of these transporters such as the SSRIs, they exaggerate the actions of 5-HT in the gut. Okay, so it explains some of the common side effects of these drugs, which include the diarrhea. So those who are taking these drugs, like the persons who are suffering from the clinical depression, they suffer from the side effect, that is diarrhea. And this diarrhea, it is because of the excess of 5-HT which is present extracellularly. When I say extracellularly, I mean to say in the gut lumen. Okay, otherwise where the 5-HT is present, it is present intracellularly, that is into the enterochromaffin cells. But when this 5-HT is present outside these enterochromaffin cells, it is troublesome. That's why it is not to be kept outside. It is to be taken inside these enterochromaffin cells. If it remains outside, then it will cause the effects, that is the diarrhea. Okay, so interestingly, there is evidence for genetic defects in this reuptake system in the irritable bowel syndrome. Okay, so irritable bowel syndrome is different, irritable bowel disease is different. Okay, so irritable bowel disease, it consists of Crohn's disease and the ulcerative colitis. That is exactly it is entirely different. But the irritable bowel syndrome, it is found that there is some genetic defect in the reuptake mechanisms of the 5-HT, and it might explain the rather bewildering symptoms of this particular disease. Okay, so next is smooth muscle. So in many species, although only to a minor extent in humans, Smooth muscle outside the gastrointestinal tract, for example the uterus and the bronchial tree, they also get contracted by the 5-HT. Why it says that to a minor extent in humans? The reason is that the receptors which are present in the smooth muscles of the GI tract in humans, the same receptors are very rarely present in other smooth muscle tissues like in uterus and the bronchial tube. And that's why in humans 5-HT has minimal effects on this particular smooth muscle containing tissues, that is uterus and the bronchial tube. Okay, so blood vessels. The effects of 5-HT on blood vessel, it depends on various factors, and which include the size of the vessel, the species, and the prevailing sympathetic activity. Large vessels, both arteries and veins, they are usually constricted by 5-HT, although the sensitivity it varies greatly. Okay, so this is the result of direct action on vascular smooth muscle cells, which is mediated through 5-HT2A receptors. Okay, so understand this very clearly. When we have studied about receptors of the serotonin, we have mentioned locations of it also. So here you can find its utilization. If you remember those locations, then you will be able to understand the effects serotonin produces on various organ system, and also try to remember the post transduction mechanism of this particular receptor, that is the primary signaling mechanism which we have mentioned over here. Okay, so that primary mechanism is actually responsible for the contractile response of these vascular smooth muscle cells. Okay, so dilatation of the large intracranial vessels, it contributes to headache, whereas activation of the 5-HT1 receptor, it causes constriction, perhaps contributing to the anti-migraine action of these drugs. Okay, so let us move to the other topic, that is the migraine. Okay, so migraine is characterized by the pain. It is only half part of the uh, head, it aches. Okay, and this headache, it is because of the dilatation of the large intracranial vessels. So that's why the agonist of this 5-HT receptor, they are to be avoided. But there is another postulation, that is activation of the 5-HT1 receptor, it causes the constriction of the vessel. So if the dilatation of the vessels is causing the headache, then constriction will relieve the pain, isn't it? It is so. That's why we are not exactly very sure that how this 5-HT it can be used as an anti-migraine agent, but it produces the beneficial effects in these migraine conditions. Okay, so further research is going on the role of the 5-HT in the treatment of the migraine. Okay, so 5-HT it can also cause vasodilation indirectly by releasing the nitric oxide from the vascular endothelial cells and inhibiting noradrenaline release from the sympathetic nerve terminals. Okay, so next is platelets. 5-HT it causes platelet aggregation by acting on 5-HT2A receptors, and the platelets that collect in the vessel, they release further 5-HT. So it is like a domino effect. Okay, so if onto one platelet the 5-HT is acting, it will activate further platelets, and these further platelets will release the 5-HT further. So it is domino effect. Okay, so if the endothelium is intact, 5-HT release from the adherent platelets, it causes vasodilation and it helps in to sustain the blood flow. Okay, so if the endothelium is damaged, that is by atherosclerosis, the 5-HT it causes constriction and it impairs the blood flow further. This sentence is very important. The primary stimulus is responsible for the change in action of the 5-HT. Okay, so what is the primary stimulus? It is the integrity of the endothelium. If it is intact, then it causes vasodilation and it keeps the blood flow better. But if the endothelium is damaged, its integrity is compromised, then in that case the 5-HT it causes constriction and thus it impairs the blood flow. Okay, so these effects of the platelet derived 5-HT, they are thought to be important in the various vascular diseases. Okay, so next is effect on the nerve endings. 5-HT it stimulates nociceptive. Understand nociception is like feeling of or sensation of pain, and the nerves that carry this particular feeling or sensation of pain, they are called as nociceptive nerve endings. Okay, so these sensory nerve endings are stimulated by the 5-HT, and it is an effect which is mediated mainly by the 5-HT3 receptors. Okay, so we have seen the 5-HT3 receptor, they are the ligand gated ion channel, and when they are activated they cause influx of the sodium. Okay, so if we inject the 5-HT into the skin, the 5-HT it causes pain, and when we give it systemically, it elicits a variety of autonomic reflexes through stimulation of afferent fibers in the heart and the lungs, and it further complicates the cardiovascular response. Okay, so in some species, mast cells they release 5-HT when stimulated, and the nettle sting it contains 5-HT among other mediators. Okay, so 5-HT it also inhibits transmitter release from the adrenergic neurons in the periphery. So this effect of the 5-HT it is probably due to the presence of autoreceptor onto the adrenergic presynaptic neuron. And what autoreceptors do? These autoreceptors they prevent release of the neurotransmitter from the neuron. Okay, so understand this very clearly. Although this is the adrenergic neuron, but 5-HT is acting on it. So you should think that these adrenergic neurons they must be present in like periphery or in vicinity of the tryptaminergic neurons. Okay, so that's why there is cross regulation taking place in this case. Okay, so next is central nervous system. So the 5-HT is an important neurotransmitter in the CNS, and several important antipsychotic and antidepressant drugs they act on these pathways. LSD, which is a narcotic substance, habit forming substance, is a relatively non-selective 5-HT receptor agonist or partial agonist which acts centrally as a potent hallucinogen. Okay, so however its actions are very complex. 5-HT excites some neurons and it inhibits others. It also acts presynaptically to inhibit transmitter release from nerve terminals, and this might underlie some of the actions of the serotonergic drugs in migraine. Okay, so different receptor subtypes, they mediate these effects. Okay, so drugs that act on 5-HT receptors. So first of all, we are going to just enlist 5-HT receptor agonist, and then we will move to the actual point, that is 5-HT receptor antagonist. These compounds, they differ in their chemical structures and their actions. The important agents are the 5-HT1A agonist, that is example is buspirone, and it is utilized as anti-anxiety agent. Then second drug is the 5-HT1D receptor agonist, and the example is sumatriptan, and it is used in treatment of migraine. Then we have third, that is 5-HT4 agonist, and the example is cisapride, and it is used in treatment of the gastroesophageal reflux disease, that is GERD, GERD. Okay, and then lastly we have that is non-selective 5-HT agonist, example is LSD, and this drug is the narcotic substance. Okay, so next is the 5-HT receptor antagonist, and the examples which are mentioned over here, that is the first one, that is Methysergide, Cyproheptadine, then Pizotifen, then Ketanserin, then Ondansetron, Granisetron, Allosetron, and Palanosetron. They are all belonging to one particular class of drugs. And then we have the drug that is Clozapine. Okay, so we are going to study these drugs one by one, and then we will finish with this particular chapter. So first is the Methysergide. So Methysergide is a congener of the LSD, and it is a 5-HT2A and 5-HT2C antagonist. Okay, so it is effective prophylactic agent in the management of migrainous headaches. The protective effect of this drug, it develops within 24 to 48 hours after administration, and it persists for similar period after its withdrawal. The rebound headaches, they may occur after sudden cessation of therapy. That's why we have to taper the doses of the Methysergide. Okay, so it is indicated for use in patients with resistant migraine, but it is of no value in treating the acute attacks. Okay, so in case of acute attacks or the sudden attacks of the migraine, we cannot go for this particular drug because it takes some time to develop the effect, and in acute attacks we require acute action, and that is not given by the Methysergide. Okay, next is adverse reactions. The significant toxicity, it is observed in almost 40% of the patients on chronic therapy. The serious toxic effects, they include the peripheral arterial insufficiency, then precipitation of angina, then retroperitoneal fibrosis with obstruction of the urinary tract, pleuropulmonary fibrosis, and the cardiac valve damage. And due to these serious adverse effects, it is now rarely being used. The next drug is Cyproheptadine. This compound, it has structural resemblance to the phenothiazines, and it is a potent antagonist of the 5-HT2 receptors, and to a certain extent it is of histamine and acetylcholine receptor antagonist. So as a central depressant, it exhibits anticonvulsant and the anti-tremor activities. Okay, so cyproheptadine, it is satisfactorily observed from the GI tract, that is given by the oral route, and the metabolic fate of the compound is not known. That is, we don't know exactly what happens to this drug when it goes inside the body. What type of metabolic reaction takes place, what type of metabolites we get, it is not known. Okay, so it stimulates appetite, probably by acting directly onto the hypothalamus. So weight is gained rapidly during first few weeks of the therapy, and it is lost when the drug is stopped. There is evidence that 5-HT is involved in the control of the ACTH secretion, possibly by stimulating corticotropin releasing factor, that is CRF, from the hypothalamus. Okay, ACTH, it is released from the pituitary. Okay, and the CRH, it controls its release. So what this 5-HT, this particular 5-HT is doing, 5-HT stimulates this CRF release from the hypothalamus, and therefore it increases in the ACTH secretion also. So administration of the cyproheptadine, it can block release of the hydrocortisone, and thus in fact it has been used in treatment of the ACTH dependent Cushing's disease. Okay, so it also suppresses aldosterone production in idiopathic aldosteronism. Okay, so adverse reactions of the cyproheptadine, they include the common adverse effect is transient drowsiness, which seldom necessitates withdrawal of the drug. Then other adverse reactions include dryness of mouth, mental confusion, ataxia, dizziness, headache, and visual hallucinations. So if you think the dryness of mouth and some other side effects, they are not solely dependent on its antagonistic action on the tryptaminergic neurons. Some of these adverse effects, they are associated with its effect on the cholinergic as well as histaminergic neurons also. Okay, so therapeutic uses of the cyproheptadine, they include migraine prophylaxis, then treatment of post-gastrectomy dumping syndrome and carcinoid syndrome. Its 5-HT antagonizing action is probably useful in this particular condition. Then relief of pruritus, which is associated with allergic dermatitis, urticaria, and neurodermatosis. So this action is probably due to its antihistaminic effect, as the human skin does not contain significant quantities of the 5-HT. The next is the for symptomatic relief in the seasonal and perennial pollinosis. Pollinosis, it is a condition which happens due to the pollen grains. So it is like an allergy to the pollen grains. Okay, so next is as an appetite stimulant in certain condition. However, its promotion as general appetite stimulant or tonic is not justifiable. Okay, so those patients who suffer from the loss of appetite, uh, it can be used cyproheptadine, but its use in this general appetite stimulant condition, it is not justified. So in certain cases of the Cushing's disease, this drug can be utilized. So next drug is Pizotifen. So this is an antihistaminic and 5-HT antagonist, and it is structurally related to the tricyclic antidepressants. So you should have some background to this, that this is the second drug that is acting as an antihistaminic along with the 5-HT antagonistic action. So you should have this in your mind, that some of the 5-HT receptor, they may have structural similarity with that of the histamine receptors, and that's why some of the drugs that are acting as an antagonist on the 5-HT, they are also acting as an antagonist on the histamine receptors. Okay, so this drug, it is effective in the prophylaxis of the migraine and the other vascular headaches. It may cause drowsiness, weight gain, and the urinary retention due to its antimuscarinic action. So next drug is Ketanserin. Ketanserin, it blocks 5-HT receptors, mainly 5-HT2A, and thereby it antagonizes vasoconstriction, platelet aggregation, and the bronchoconstriction. It has affinity for the adrenergic alpha 1 and H1 receptors, which it blocks. So again, some structural similarity must be existing between 5-HT2A receptor, adrenergic alpha 1A receptor, alpha 1 receptor, and H1 receptor. Okay, it can cause lowering of the blood pressure also. So this drug is used to improve digital circulation in patients with vasospastic condition such as Raynaud's syndrome. So what is digital circulation? Digital circulation, it is the blood circulation to the digits, that is to the fingers or the lower extremities. Okay, so in Raynaud's syndrome, it is observed that there is vasospasm, that is constriction of the blood vessel, and as there is constriction of the blood vessel, the blood flow to the extremities, it gets reduced and it is painful, and that's why this drug, it can improve this circulation to the lower extremities, and thus can relieve the patient of the pain. Okay, so next is Ondansetron and some other drugs. So this is a specific 5-HT3 receptor antagonist drug, and it is particularly useful as an antiemetic in nausea and vomiting, followed by cytotoxic drugs and the radiotherapy. So its action is partly central and partly peripheral. It is given orally in the dose of 8 mg 1 to 2 hours before treatment, and in the same dose 12 hourly thereafter. The drug can also be given by the slow IV infusion and as mouth dissolving tablets. It causes sometimes headache, constipation, allergic reactions, and the chest pain. Unlike phenothiazines, it causes neither sedation nor EPR. EPR stands for the extrapyramidal reaction, that is Parkinson's-like syndrome. Okay, so Ondansetron, it is like a most common drug which is used like over the counter and or against the prescription, and you may have heard about the drug name, that is Ondem. So Ondem, what it is consist of? It consists of the Ondansetron plus domperidone. Domperidone, it is a dopamine receptor blocker. Okay, and the Ondansetron, it is the 5-HT3 receptor antagonist. Okay, both of these drugs, when they are combined, they help to regulate the vomiting reflex. Okay, continuously if a person is vomiting, in that case this combination is given by IV route. Okay, and the last drug, that is Clozapine. This is a typical antipsychotic drug. It acts as 5-HT2A2C receptor antagonist, and it is used in treatment of the schizophrenia. Many other antipsychotic drugs, they have 5-HT antagonistic action also. Okay, so with this we have finished with the chapter, that is serotonin, and we will next move forward to the chapter, that is prostaglandins, from next lecture. Okay, so that's all from my side, and this I will conclude my today's lecture, and thank you.